Can biomarkers help diagnose lymphoma? Can biomarkers help diagnose lymphoma? The answer is yes. Biomarkers play a significant role in diagnosing lymphoma, including non-Hodgkin lymphoma. They provide crucial molecular and cellular information that helps identify different lymphoma subtypes, assess prognosis, and guide treatment decisions. While some biomarkers are well established in clinical practice, others are still being researched for their effectiveness. So, what exactly are biomarkers in the context of lymphoma diagnosis? Biomarkers are measurable biological molecules, such as proteins, genes, or metabolic products. They indicate normal or pathological processes in the body. In lymphoma, these biomarkers can be found in blood, tissue, or tumor cells. They include genetic mutations, protein expression patterns, and metabolic changes. When it comes to non-Hodgkin lymphoma, biomarkers are essential for classifying the disease into various subtypes. This classification is critical because the treatment and prognosis can vary significantly between subtypes. For instance, genomic profiling can differentiate subtypes of diffuse large B-cell lymphoma, which is the most common form of non-Hodgkin lymphoma. This classification helps predict how well a patient might respond to treatment. Certain proteins, such as MYC and BCL2, are assessed to distinguish diffuse large B-cell lymphoma from more aggressive types of lymphoma. Various techniques are used to analyze these biomarkers, including immunohistochemistry, flow cytometry, fluorescence in situ hybridization, polymerase chain reaction, and next-generation sequencing. However, not all biomarkers are perfect. For example, lactate dehydrogenase and beta-2 microglobulin levels are often elevated in lymphoma, indicating tumor burden. But they lack the sensitivity and specificity needed for a standalone diagnosis. Similarly, while Ca1-5 expression can relate to the malignancy degree, it is not widely used for diagnosis due to its poor specificity. Emerging biomarkers and technologies are also on the horizon. Advances in molecular technologies have identified genetic and epigenetic alterations that could serve as potential diagnostic and prognostic biomarkers. Gene expression profiling and sequencing can detect mutations in genes like MYC, BCL2, BCL6, and TP53, which can influence lymphoma behavior and patient outcomes. Additionally, metabolic biomarkers reflecting cancer cell energy metabolism are being studied for their potential in early detection. In clinical practice, while some biomarkers are routinely used to support lymphoma diagnosis and subtype classification, no single biomarker is sufficient on its own. A comprehensive diagnosis relies on integrating clinical presentation, imaging, histopathology, and biomarker data. Biomarker testing also helps guide prognosis and treatment selection, allowing for more personalized therapy. Ongoing research aims to identify more sensitive, specific, and non-invasive biomarkers for earlier and more accurate lymphoma diagnosis. In summary, biomarkers are valuable tools in diagnosing and managing non-Hodgkin lymphoma, especially in defining subtypes and prognosis. Their use complements traditional diagnostic methods, but is not yet a standalone solution for definitive diagnosis. If you suspect lymphoma, it is essential to undergo a thorough evaluation by healthcare professionals, including appropriate biomarker testing, to ensure accurate diagnosis and optimal care.